Welcome back to Studio 10. Of course, we've all had those mornings when we didn't get enough sleep. Seems like there's just not enough concealer in the world to cover up the dark circles and bags under our eyes. Well, when you look in the mirror, if you see someone who looks tired, and if you feel like you've tried every eye cream out there, maybe a lower eyelid lift would work out better for you. Dr. Burden can do it for you at Destin Plastic Surgery.
There's a point where you're going to go beyond eye creams, and you're going to need something to change the anatomy. Surgery is a great alternative for this. We're going to take those bags out. We're going to make that eye look youthful again. The eyelid itself isn't the problem. It's the cheek pad that was once up here, nice and full, like you were when you were, 19, 25.
Yeah.
It drops. And so this drops down, and we develop a little circle here. And then the fat beneath the eyelid starts to bulge forward.
What do you do? How do you fix this?
Well, we make a small incision under the eyelid, and if you look at this picture, you can see this person who has a little bag, and this is a young person, a little bag beneath the eye. And now, after we have raised that cheek up and removed the extra fat, that eyelid now looks youthful again. The biggest problem for this surgery, however, is the downtime. It's not very painful, but you're going to be bruised and swollen for, I'd say, count on at least 2 weeks.
Right, because that is such a thin area, even when you're putting on eye cream, they say to be so gentle.
Well, some people are very lucky. They'll get away with 5-7 days, but most people need 10 to 14 days before they're presentable socially again.
Okay.
They can work and do things in a matter of 24, 48 hours, but the problem is the bruising.
Now, is this a permanent fix, or will gravity continue to take hold?
It's more of a reset. So that person will now have a youthful looking eyelid, but as time progresses, the same things will occur. You usually get 10 to 15 years out of an eyelid operation.
Is this something that you can have done again 10, 15 years later?
Yes. No, many years ago, you would see people only have these operations when they were maybe 55. So by the time they were 70, they're not thinking about it anymore. But now, people are living to be 90, 95 years old. So if you have your first operation, let's say at 45, then again at 60, you may have another one at 75, 80. So people are having this operation more frequently than they used to have in the past. Used to, it was a one-time deal. Now it's maybe twice or 3 times.
Will injectables help this?
In the early stages, a younger person, maybe in their 20s or 30s, even into their 40s, an injection in this little tear trough can help. But there's some point to where you keep injecting, then your cheeks look full and puffy and it looks unattractive. So there's a point where the injectables won't work either. When you've done all the non-surgical things, aren't giving you the result you want, surgery's the way to go.
Doctors can do some pretty amazing things these days, can't they? Well, Dr. Burden, you just saw the number on your screen. It's also on our Studio 10 page on fox10tv.com, so you can call Destin Plastic Surgery, schedule an appointment with Dr. Burden. If you are just tired of buying those expensive eye creams that don't work and you're tired of looking tired, go see Dr. Burden.